Good afternoon. My name is Emily Cribas. I'm a PhD student at Penn, and today I'll be talking on federal drug decriminalization. So, illicit drug use in the United States is common. Over 20% of Americans have consumed an illicit drug in the past year, but drug use is associated with high disease. This is measured by disability adjusted life years or DALYs. DALYs attributed to drugs can be due to both indirect causes and as well as direct causes such as overdoses. When we look at these numbers, we see that indirect consequences of drug use have led to an increase in premature deaths that come from underlying substance use disorder, suicide, HIV/AIDS, and hepatitis-driven cancer and cirrhosis. On the other hand, drug overdoses are largely associated with opioid consumption, and over 70% of opioid related deaths are due to the presence of illicitly manufactured fentanyl in the drug supply that result in accidental overdose. So these data show that it is the individual risk factors and governmental policies rather than the effects of the drugs themselves that contribute to a majority of illicit drug related harms. Despite this data, we continue to criminalize the drugs themselves. This is shown through the passage of the 1970 Controlled Substances Act that is still in effect at the federal level. And this passage of this act has led to racial disparities when it comes to incarceration. So African Americans, despite making up only 13% of the population, are incarcerated at the same numbers and total percentages as whites when it comes to drug offenses. These policies are also ineffective. Over 77% of released drug offenders return to the prison system within 9 years. Additionally, the Controlled Substances Act, along with other war on drugs policies, have resulted in and are a major driver of mass incarceration in the United States. Over 46% of prisoners are currently serving time for a drug offense. This hasn't gotten much better. In 2011, we passed the Fair Sentencing Act that helped a little. It decreased sentencing disparities between crack cocaine and powder cocaine from 100 to 1 to 18 to 1 years, despite being the same exact drug. Additionally, African Americans are still being arrested for drug use at twice the rates as whites, despite consuming drugs to the same rates. These slow incremental changes will not address the harm that we've done from the original Controlled Substances Act. And so we need a new approach. Criminalization and penalization for taking drugs is not working. An alternative to this is drug decriminalization. What this means is eliminating criminal penalties for drug use and possession, drug paraphernalia, and low-level drug sales. What this would do is redistribute costs associated with arrest, convictions, incarceration, law enforcement, and all the other underlying costs of the war on drugs to public health measures that promote harm reduction, safe drug use, treatment for substance use disorders, education that is not based on abstinence and is based on science. Additionally, this would make room for funding for biomedical research. A lot of hallucinogenic compounds that are currently scheduled as class 1 drugs have shown incredible potential to treat depression, anxiety, and PTSD, but the funding is not available. Additionally, the criminalization makes it difficult to obtain for research purposes. This concept of drug decrim is not new. In Portugal, they implemented personal drug decrim in 2001 and saw a dramatic reduction in overdose deaths, HIV diagnoses, and the number of people incarcerated for drug offenses. And the United States is asking for something different too. The majority of Americans favor treating drug offenses more like traffic violations than actual felonies. Several cities and the state of New Mexico have decriminalized in the past 2 years some kind of psychedelic plant medicine. Two ballot measures in this November also cover some form of drug decrim. And although these are not perfect, It is a start. Additionally, 50 drug scholars have come together to write a manuscript calling for the immediate decriminalization of recreational drugs for the eventual legal regulation. And this is in light of Taylor, and George Floyd's death. In effect, they're calling for an end to the war on drugs that has exacerbated racial disparities more and been a component of systemic racism for a long time now. With that, I'd like to give some acknowledgements and thank you for your time.